1. The Biden administration established the Office of Climate Change and Health Equity, OCCHE, the first office of its kind at the national level. 2. Authorities said people who are most affected by the COVID-19 pandemic will be the same groups struggling with the health impacts of climate change. 3. Experts say climate change remains the biggest threat to public health. The Department of Health and Human Services, HHS, on Monday established a new office to address the burden climate change places on public health, particularly on vulnerable groups. The Office of Climate Change and Health Equity, OCCHE, the first of its kind to address climate change and health equity at a national level, was outlined by an executive order from President Joe Biden in January. Scott C. Ratzan, MD, an expert in health communication at the CUNY Graduate School of Public Health and Health Policy, says that the new office is an essential step in tackling environmental health issues and inequities exposed by the pandemic. What happens in health care is not solely determined by medical care, Ratzan tells very well. All the social determinants and environmental determinants have been clear in what we've been trying to deal with for years, in international treaties and so forth. So now it makes even more sense that the U.S. would put this front and center. The pandemic has highlighted health disparities among vulnerable communities in the U.S., many of which will be the same groups affected by climate change, HHS Assistant Secretary for Health Rachel L. Levine said in a press release. We will use the lessons learned from COVID-19 to address these disparities, prioritizing and protecting the nation's health, Levine said.